One of the most common questions I hear from patients in the United States is this: how much weight will I actually lose? And the honest answer is, it depends on several factors. Bariatric surgery is a powerful tool, but it is not magic. Let's talk about realistic expectations. With gastric sleeve, patients typically lose about 60 to 80% of their excess weight within the first 12 to 18 months. With gastric bypass, the numbers are often similar, sometimes slightly higher, especially in patients with higher BMI or metabolic conditions. But here's what's important to understand. We measure excess weight loss, not total body weight, so the results are individualized. For example, if a patient has 100 pounds of excess weight, losing 60 to 80 pounds in the first year is realistic when the process is followed correctly. The first 3 to 6 months are usually the fastest phase. Then weight loss gradually slows, which is normal. This is where structure and follow-up matter most. Surgery changes anatomy and hormones, but long-term success depends on behavior, nutrition, activity, and consistency. That's why follow-up is part of my treatment model, especially for patients traveling from the United States, Puerto Rico, Panama, or the Dominican Republic. We continue monitoring progress virtually. We review labs, we guide nutrition. Now let's talk about something equally important: expectations beyond the scale. Weight loss surgery is not only about numbers, it's about improvement in blood pressure, improvement in blood sugar, better mobility, less joint pain, more energy. Those changes often begin within weeks. And for patients with type 2 diabetes or severe reflux, metabolic improvement can be significant. However, there are also realities to understand. Plateaus happen, body adaptation happens, and in some cases, weight regain can occur if structure is not maintained. That's why patient education is critical. In my practice, I emphasize realistic outcomes, clear communication, and long-term planning, not exaggerated promises. If you're considering bariatric surgery in Mexico, focus on this: proper indication, structured process, long-term follow-up. Those are the elements that produce sustainable results. If you'd like to understand what realistic expectations look like in your specific case, the next step is a virtual consultation. Because the right plan begins with accurate information.